All right, a very warm welcome to you for this second um, preparatory meeting of the Nigeria Immunization Collaborative in collaboration with UNICEF and NPHCDA, the National Primary Healthcare Development Agency. So, first of all, before we go any further, we mark the occasion of Eid and we, on behalf of the Geneva Learning Foundation, I wish to extend our warmest wishes to those among our global community, but also our Nigerian community who celebrate this occasion. Um, and we wish you well and for this on this occasion. Now, we kicked off last Monday the launch campaign for um, for this immunization collaborative. We are opening today the call for local partners, and today is the partner coordination call for ambassadors and IA2030 movement leaders. And the big focus really today is on the official launch of the collaborative and the announcement that will be made at Teach to Reach 10. So I'd like to make sure that everyone who is participating is fully aware of Teach to Reach 10 and will explain who will be in attendance as guests of honor from this nascent immunization collaborative for Nigeria, representing Nigerian leaders of the movement for immunization Agenda 2030 on Thursday, because that is when we'll be having this. Let me see. Yeah, this here. Let me just fix this again. Yeah, here we go. All right, we have some technical difficulties trying to use our mobile studio today. So let me just here make sure we have, yeah. All right, make sure that you can see here the Teach to Reach 10, just in case any of you are not already registered, because we are going to be announcing and launching the collaborative for the Nigeria movement for immunization Agenda 2030 at Teach to Reach on Thursday. You can see here, it's in 2 days, 16 hours, 26 minutes and 32 seconds. It opens on Thursday morning. We hope that you will be with us. And you do not want to miss this. We're going to have a massive celebration of the 50th anniversary of the expanded program on immunization, EPI. The immunization since the launch of EPI is estimated to have saved 154 million lives, and this is going to be what we will be celebrating on Thursday. This makes the launch of the Immunization Collaborative even more of a momentous occasion. Just as a reminder, just in case I think most of you have done this, you want to type in your name, type in your email. If it's the first time you're doing it somehow, if you've missed previous Teach to Reaches, then make sure you follow the instructions that are given here. You will then by email be led to this page. This is called Ring Central. And there you can see the full schedule here. And June 20th is the day where everything is in English. The 21st, everything will be in French, so do not get confused. You can see here there are other sessions, of course, on climate change and health. But what we're most interested in here is the EPI at 50. And you'll see that there are 2 moments during the day on Thursday this week where we'll be launching the Nigeria Immunization Collaborative. So the first is at, I believe it's 2 p.m. Abuja. Charlotte will correct me if I am wrong, and where we'll be celebrating EPI at 50. But there is also in the morning, very early, right after the tutorial and right after the local leader and partner forum, we'll have in the opening ceremony, we will have the first launch of the Nigeria Immunization Collaborative. So there are really 2 occasions for you to really participate in the launch, one in the morning and the other in the afternoon for the EPI at 50 celebration. We encourage everyone to join the opening ceremony. This is really a powerful moment when everyone in the Teach to Reach community is together. So immunization and other primary healthcare staff will be together with us from all over the world. So that is what we're looking forward to. We'll then be going into on Monday, the 24th, we'll have a launch event specifically for the collaborative. All right. And then let me just try to, yeah, there's one member in our team who is having some difficulties joining. So then you can see that we'll have one more partner coordination call. The applications will close on the 5th of July. Letters of acceptance will be sent out on the 8th. And then 1 week after that, we'll be launching the exercise. So for every member who has been invited to these coordination and preparation calls, you still will need to complete the application, but you are guaranteed, if you have attended the collaborative meetings ahead of the launch, you will be automatically admitted. You still do have to complete the application, and the application has to be of sufficient quality. So that is the schedule. Once we kick off the exercise, we'll start on the 15th of July, and then we'll have 2 sessions. Those are what we call the General Assembly on the 16th and 17th. So that is the Tuesday and the Wednesday. Then we'll have the following Monday a General Assembly to share experience, and then there will be other activities for those of you who are familiar with the Geneva Learning Foundation's accelerated peer learning methodology. You'll get to develop a project and peer review that project as prepared by your colleagues. So this is what we're looking ahead to. The key focus is really right now, this week, is on this Thursday with the Humanly Possible Vaccines Work Movement for Immunization Agenda 2030, celebration of EPI at 50. That's the expanded program on immunization. We really can't wait to have this celebration with you. And of course, Nigeria, as the largest community in the network of the global network of the Geneva Learning Foundation, will be front and center. For everyone to understand that Teach to Reach 10 is truly massive. Some of you have been here since the first Teach to Reach. We have now reached over 21,161 health professionals who are registered for this massive event this Thursday, the 20th of June. So you don't want to miss this, with over 21,000 people registered. And there will be a major focus on the movement for immunization agenda 2030. Now, the conference and networking platform, if you have not, the first thing is to go, if you have not already done so, to make sure you have requested your invitation for Teach to Reach. So if you have, I'd like to ask now if you can go to the chat, and if you if you have requested your invitation, type yes. If you have not yet requested invitation, type no, and then please follow the link and go ahead and do it. So in my case, it is yes. Please go ahead and type the invitation. Okay, so Josiah, please, I would ask if you could go follow the link and make sure that you do not miss this event on Thursday. Saidu Dahiru Habib, the same thing. This is really something that no one who is involved in immunization will want to meet. There are actually an impressive number of Nigerian organizations involved as partners. So you can see here the partners and supporters include, of course, UNICEF, given that with UNICEF we are working on this immunization collaborative with NPHCDA, but also in terms of Nigerian organizations, eHealth Africa and EHA clinics are at the top of the list. Among them, you should recognize a number of other Nigerian and other regional organizations as well here. So this is a remarkable event. And the key is, once you have requested the invitation, is really to go to to what is called the Ring Central website, and there you need to register. It is completely free, of course, for health professionals from countries. So yeah, and thanks for sharing the link. I'm also looking for okay. All right. So now, Teach to Reach, of course, the big focus and where we will be announcing and launching the collaborative is the 50th anniversary of the expanded program for immunization. Teach to Reach 10 is also focused on climate change and health. And so there will be sessions following the opening ceremony and before the EPI at 50 celebration. If you are, as a health worker in immunization, are concerned about the effects of climate change on health, there are a number of sessions that we hope you will be able to attend. So any questions so far? I'm going to turn to Charlotte. I know she's struggling with connectivity, but Charlotte, are you able to speak to us? Yes.
Yes, Brother Josie, there are no questions or comments yet
Okay.
that require your attention. Yeah.
All
I just
right.
want to share a link to the schedule on Ring Central. I'll put it in the chat right away.
Great. Yeah. Yeah. All right. So that is for Teach to Reach Connect. And we hope that you will be able to join us on Thursday. We hope you won't miss it. This is going to be just quite a memorable and exciting event given the 50th anniversary of EPI and the launch of this collaborative. So that is as a preamble. We're now going to dive into the work for this session and the work that we're going to do together. So there are 386 Nigerian scholars registered for today's call. And we have an update. Last week, we invited you, there was a call to action to share let me show you if I can find to share this message on 10th of June, really a sort of pre-launch announcement. There are quotes from Usman Tijani, Ibrahim Abdullahi Maikano, who spoke during the meeting, and you can see there were 35 likes, 17 comments, and 18 reposts. So that is out of 386 Nigerian scholars who are invited, who are registered for this call. I think this number was lowered. It's gone up since last Monday, but there's still a considerable amount of people. So what I would like to ask is, if you have not yet done so, is to click on the link that is in the chat, and let's see how many likes, how many comments, how many reposts we can get on this new post. Right now, we're at 35 likes, 17 comments, and 18 reposts. I'm actually going to paste this here so we can see it. And we're going to see it I'll give you a few seconds if you haven't gone there yet, if you'd like to do that now. Let me just, oops, yeah. And let's see if we can make this go up. Why does this matter? It matters because, like it or not, the chance that your colleagues are going to see this message is heavily dependent on how many likes, how many comments, how many reposts. All right. And so let me reload and see if there are. So we'll check again to see if there are. Okay, right now there's one additional like. There are now 36 likes, 17 comments, and 18 reposts. If you added a like, please take the time to add a comment and to repost to your network. This really makes the biggest difference when going to dissemination on social media. Now, the goal, of course, why are we asking you to do this? Why did we launch this call to action? Is to involve your colleagues. Of course, we know you as committed, dedicated leaders in the movement for immunization Agenda 2030, in Teach to Reach, in other activities supported by the Geneva Learning Foundation. But we asked you, and we shared a link with you so that you could document your dissemination efforts. And this is so that we could recognize you today. And you can see here the names of the 23 movement leaders who contributed to dissemination together with the numbers that you said you reached. So Charlotte, I'd like to ask you to read their names. And there are 23 contributors that we want to honor in this way.
Okay, right. So we have Abdul Malik Yusuf, that reached 100 people. Abubakar Hamza, 1,500. Abubakar Suleiman, 1,000. Adamu Lodo Abubakar, 500. Adamu Galadima Dangona, 6,000. Aliyu Abubakar Dauda, 50. Angela Chinweze, 1,000. Buka Alaji Ibrahim, 1,000. Dr. Ezeama Martina Chika Utinaka, 400. Dr. Mani Ahmad, 50. Fatima Zara Abubakar Utaru, 10. And Guam Henry Moses, 1,000. Thank you, Reda.
Yeah, there's a second screen because there are 23 altogether.
Ah, okay. Haruna.
All right. I know Charlotte is having connectivity problems, so I'm going to finish for her. We want to honor today Haruna Adamu, who reached 4,000. Says everyone on my handle, Kelechi Obaji. And Charlotte, if you're able to hear, if you're able to unmute or activate the microphones of those whose names we are honoring today, so that we can then hear firsthand what you did for dissemination and what feedback you got from your networks. Ndayo Iwat, of course, reached 100. Mohamed Yakubu reached 1,000. Magaji Ubaleado reached 300. Kennedy Adejo reached 100. Kelechi Obaji, reached 10. Patience Adeda reached 5. Rebecca Bello reached 1,500. Sabitu Sanusi reached 20. Ukamaka Okafor reached 10,000. And Zakaria Saleh Shehu reached 300. Now you can see again that this was the dissemination register. If you check your email, you will see that we shared a link, and through this link, you could actually document your dissemination. Now we do have to note that this represents 6% of the participants of the 386 participants who registered for these calls. So that makes each of you even more commendable, and this is why we wanted to honor you today. Now I see Ndayo Iwat, a longtime leader and one of our most senior members, I would say. Ndayo, we'd love to hear from you. We are honoring you today for having contributed to the dissemination even before launch of the Immunization Collaborative. What would you like to say to your colleagues today?
I want to say I'm immensely honored. Reza and Charlotte at the Geneva Learning Foundation, I'm so proud to be part of this organization. Yes, I belong to a network of so many immunization workers from AfriHealth. We also have the professional platform. I just decided to indicate 100 people that I will reach consecutively, because I know very well that I can reach over 500,000 people. But I'm very sure that these 100 people, that they are going to, at least 50% of that should attend. So I use my platform. I'm the General Secretary of the Coalition of Health Sector Reform CSOs in Nigeria. I won the election on the 18th of April. So we are now coordinating all the CSOs in Nigeria. And I put it there. And also the Federal Capital Territory WhatsApp platform for health sector NGOs and CSOs. I put it there. And these are platforms that are having not less than 500 members each. Then I went to my Twitter handle. I put it there. Basically, I did not put the link when I was sharing with the Geneva Learning Foundation. I also did it in my discipline, and that was excellent. And
Notice back from 15, as I speak to you now, that I've guaranteed their attendance, and they are working with the FCT Primary Healthcare Board, the immunization officer for FCT Federal Capital Territory of Nigeria, the co-chain officer, and the doctor.
I'm afraid we lost Ndayo Iwat, but thank you for his. We appreciate his contribution. Ukamaka Okafor, you reported reaching 10,000 pharmacists, other health professionals, non-health professionals in your network. Can you tell us about that? And first of all, we want to, of course, recognize and honor you and the 22 colleagues who reported on their dissemination efforts.
Okay, thank you very much, Reda. I'm delighted once more to speak on this platform. My network has been my strength for some years, and I'm admin in many of my networks. Like I'm secretary of the West African College of Pharmacists, and we have not less than 2,000 pharmacists there. The Pharmaceutical Society of Nigeria too, we have up to 6,000 persons, both on Telegram and on WhatsApp. And I also shared to the hospital and admin pharmacists, and then the public health pharmacists, and also to the community pharmacists, that where my strength lies in the community, who I know that when they take up immunization, that they are going to have more coverage than ever, because the community normally go to the community pharmacists. So I use all those platforms, including pharmacy students, also to share to my networks. I also shared to my networks on LinkedIn and shared on Twitter. And I also spoke to 1 or 2 persons that I know that are interested in vaccination, and some of them have joined on this call. Thank you very much.
Wonderful. Thank you very much indeed, Ukamaka Okafor. Now, we'll come back to you and others to ask you what exactly you said, how you explain what this immunization collaborative is to others, and what their response has been. But we want to continue, again, recognizing the 39 who reacted on LinkedIn. So that is the likes that have been shared. So you can see the names here for those 39 that we wish to honor today. We have the comments. So I believe that is 14 people who made comments, and you can see the comments here. And every comments count more than likes. They count more than anything, in fact, in determining the likelihood that anyone else is going to hear about the Immunization Collaborative. So that is why we're spending so much time on this today. And then we will look at the results of all of this, all of these activities. There's one more aspect that we have not covered yet, and that is that we also invited not just you as an individual, as a leader, to become part of this collaborative, but we also invited organizations. And so far, 12 organizations have expressed interest in becoming partners of the Immunization Collaborative. So you can see the list here. We do have a question about, given WHO's special role in Nigeria, we had Bukar Ibrahim and Sabitu Sunusi, who both said that they were authorized by WHO to register as partners. So we'll be going, let me see if Bukar is here. Charlotte, do you see Bukar or Sabitu?
No, none of them are in the room right now.
Okay, neither is in the room. Okay, so we'll have to go back to them, and we'll be following up for Ajarasu Nigeria Limited, eHealth Africa, and Cervical Cancer Nigeria Initiative, Fafa Business Center, Federal University of Gashua, McKing, Nana Girls and Women Empowerment Initiative, Primary Healthcare, Regima Community Care Foundation, the University of Abuja, and the Youth for Change Initiative. Will be coming back to you with specific questions to confirm your engagement as a partner for the Immunization Collaborative. Now, as we said, when we added up the numbers for those of you who contributed to dissemination, so these numbers here from the 23 who took the time to report on their dissemination efforts, Nigeria IA2030 movement leaders, you told us that you had reached almost 30,000 health professionals through your efforts. So that is, of course, entirely commendable. And this is why we really wanted to take the significant amount of time today to really recognize and honor this effort and the commitment that you put into sharing the pre-launch announcement. We're going to be launching on Thursday at Teach to Reach. And again, we really wish that no one who is involved with the collaborative will miss this important event at Teach to Reach. Now, what is the result? We said that you told us that you reached almost 30,000 people. So far, we have had 132 health professionals express interest. Expressing interest means that they have entered their name and their email to join fellow health workers from all over Nigeria. So we have the 132 names that are here. I think we even included Jenny Sequeira, who expressed interest, who will be part of the team for this exercise. But other than that, in principle, every person, of course, people from outside Nigeria can also express interest. But in principle, these are 132 Nigerians, or 131 who have expressed interest. And so there is a gap between what has been reported and the reality, because it means that for every 226 that you reached, one person has expressed interest. So 1 out of 226. So when you reached out to 226 people, 225 people did not respond or decided they were not interested. So that is our first question to you today. And in terms of the numbers you reached, and in particular whether or not you documented your dissemination, we're interested in hearing from you. What do you think are the dynamics here to explain this significant discrepancy between the number of people that you told us you are reaching and the actual numbers of people who have responded so far? Where is the barrier between what you have told us and the reality? So I'm going to ask, and we're looking for insights that can help us improve how we do the outreach for the Immunization Collaborative. We already know each other. We know you as committed, dedicated leaders. The goal with this Immunization Collaborative is to expand the circle and to reach new people, to bring them into the fold. They may be different from you in terms of their profiles, in terms of who they are, what they do, but this is what we need. So I'm going to go to Usman Tijani. We'll go back to Ukamaka, Tina, Rebecca, Rabiu Omalara, asking you to unmute just to share your insights into what you think is happening that could explain this kind of discrepancy. Ukamaka, over to you.
Okay, thank you very much once again. The many people that I reached personally, many of them are pharmacists, and they told me one particular reason. And they said in Nigeria that apart from during COVID pandemic, when there was so much emergency and the federal government involved the pharmacists in immunization, and after the pandemic, the federal government are no more involving them to give vaccinations, that when they come and join us in this collaboration, that what happens thereafter, that there is no policy that permits the community pharmacists to administer vaccinations to the public. And because of that, they lost interest, because many of them were permitted to give vaccinations by the Primary Healthcare Development Agency. And they were thinking that after the COVID pandemic, that there will be some policies or some regulations that will actually give them some significant role to play in immunization. And when they didn't get that, many of them lost interest. So they would like to know if they come and join in this collaboration as community pharmacists, what next after the learnings? Thank you. Over.
Hello, everyone. Good afternoon.
Afternoon, Tina.
Okay. I want to thank my colleagues that took time to disseminate the program. And I'm quite impressed with the number, 29,945. Well, those that responded are quite few, but I'm hopeful that before the re-event, we're going to have more participants that will come in. Just what I want is that we continue to send reminders, and for those that have not shared too, should also try to send the information to other areas like states that are not well represented in the invitations, because we have like 36 states. So when we see that some states are not represented, those colleagues that are there should try to maybe also share with those colleagues that are in those states, so that the coverage, the trainings and the information will go around. So these are my insight about the dissemination of information. Thank you.
Thank you very much indeed, Tina. Yep. Who shall we hear from next? I'm particularly interested in the ambassadors who are here, but also IA2030 movement leaders, as you have been at the forefront in the past of very successful dissemination efforts. And here we're just starting out, but it's important. This is by and for Nigeria and no other country. So your role, your perspective, your insights are more important than they have ever been in this collaborative. So, all right, and asking those of you whose microphones are activated, please raise your hand if you'd like to speak. But we're really looking at this question. Obviously, if you've taken the time to join this session, if you have expressed interest, registered for this call, and actually took time today to join, we're interested in what you have to say to help figure out, so we can figure out together what is going to bring not just those who are already convinced, but health professionals who in the past, they may have known of your engagement in this movement for IA2030, but they may have said, I don't see how this is going to help me. I don't see how. Yes. So Caroline, a warm welcome to you. What are your thoughts about dissemination? We haven't kicked off the campaign yet. We'll be doing that on Thursday at Teach to Reach. But what would you like to share so far? And before that, how are you doing?
I'm good, Reda, and good afternoon to everyone. I'm Caroline Akoshile. I am an alumni of TGLF. I've been attending the Teach to Reach. I mean, many of them up to 9. I mean, they were on the 10th one now. I'm looking forward to it. And then I've tried to disseminate a lot, like some of my colleagues. And then like the organization that I'm volunteering for now, we are not exactly on immunization, and Reda and Charlotte too would know that I've been introducing myself as a volunteer for We Lead Network, which with our main mission and vision is on boys and then women. Although I've introduced them and I've asked them to come and attend the Teach to Reach 10, which I believe that they would. And I would say that we all should still try to send more invitation, to all our platforms, because really, somebody like me, I belong to many platforms. So I will continue to remind the people that I've invited. And some have said they will come, like some people on the will lead, they said they will come. And I told them it's not just only immunization. We also talk about climate change, and they are interested in that. So I believe they will come. And I look forward to Teach to Reach 10 because we have a lot of networking. We used to have a lot of networking, which I believe we're going to also have this time. And mentoring, and then being mentored as well, because nobody knows everything. You learn from one another. And I still hope to invite more people, to remind them, to ask them to attend the Teach to Reach on the 20th, which is the English version. So that's what I'm doing. I'm still going to do and remind many people to attend. So I think that's what I have to say for now.
That's wonderful,
Over.
Caroline. One last question for you. How many people do you think should be part of this immunization collaborative? This is for Nigeria. How many health workers should be part of this? Is it 100? Is it 1,000?
Wow. If you ask me, Nigeria, we have over 200 million people, and there are so many health workers. I should say, like nothing less than 10,000, or too many, up to a million, I would say. Yeah, in all the states. So we still have a lot of work to do. That's what I'll say.
Yeah. And so what, Caroline, so how do you think that this, a health worker who is not already convinced as you are, because you are a leader, and everyone in this room has also demonstrated and exercised leadership in various ways for IA2030, for Teach to Reach. But what would you say? What are the words that you would use to speak to your colleague? She's good at what she does. She goes about her daily work. She faces many of the same challenges, but she's never attended Teach to Reach, and she's never followed through to actually join any of these activities. What do you say to her? Why should she bother?
Well, I would tell her that there is a lot to learn, especially from other countries, because it's not just only in Nigeria that immunization is an issue. And I will also tell her what I've learned from other people, from like DRC, like from Senegal, from Taporunga. And also, I will also tell her that I've also mentored some people that are not from my state and are from other states in Nigeria, and that they should, and we have a scholar, a scholar platform that some of us belong to here in Nigeria. I think I attend the meetings often, so we should try and reach out to everyone. Everybody on that scholar platform should reach out to people from other, on all the platforms that they belong to, and that it's a must. Since this is for Nigeria, and we want all our children to be immunized, and we don't want to leave any child out or behind, and that we want every child to attain their potentials. And we know that immunization is very important, and it is free, it is good for the child, and it will make the child to grow to be a leader in the future. And we as parents, as grandparents, we want the best for our children. That's what I'll tell my colleagues in the health sector, especially all those people in the Ministry of Health that are on, even the ones that are not on immunization. And I'll tell them, even in some other countries, in Gambia and so on, there are people in nutrition and other aspects of health that are on Geneva Learning, that have met during networking. So why would you be a health worker in Nigeria and you're not on Geneva Learning? It's the best place to be. It's the place to be. And then if you're not there, you are still not attaining what you're supposed to attain. I'll tell them.
Thank you very much indeed, Caroline. And that is actually the next question that we have for you. So I'd like to ask those of you who'd like to respond to this to do it as a role play. So imagine that you are actually speaking to a colleague. What do you say? And you can think of a colleague who so far perhaps they know that you participated in Teach to Reach or in the movement for IA 2030, but they have not joined you. What do you tell them this time because this immunization collaborative is for Nigeria and is being led by Nigerian alumni, Nigerian leaders of the movement for immunization IA 2030, such as yourselves in this room? What are the words that you use to introduce the call to action to a colleague? And here, Charlotte, I'm going to turn to you. I see many microphones activated. Who shall we hear from at this stage?
Right. We were just inviting, if you want to speak, please, can you go ahead and unmute yourself or just simply raise your hand, and we'd like to hear your thoughts. So I'm inviting Chinyere Blessing. You're able to unmute. Dr. Imam Wada Bello. If you're able to speak with us, we'd love to hear from you today.
Tina, your microphone is still unmuted. Would you like to try more explicitly, really to say what are imagine your colleagues speak to her or to him and tell them, introduce this call to action. What do you tell them about this immunization collaborative? All right, I think Tina is disconnected, unfortunately. All right, so we'll keep, and these are not easy questions that we're asking, but they are, but it is necessary. Hello? But yes, Usman Tijani, please go ahead.
So good afternoon, everyone. My name is Usman Tijani. I work with McKing. I support the national EOC, but basically my major assignment is to provide technical support in the area of immunization and polio in Northwest Nigeria. To me, what I'm looking at, the issue of inviting my colleagues is not the main thing to me, because my professional colleagues, I can easily convince them for the fact that the network is there for them. They can link up, see how immunization is taking place around the world based on the collaborative effort of Geneva Learning Foundation. But I'm looking at the other side of the story, which is going well supporting the state or local government or at the world level. When you go to the communities, the health facilities, there are a lot of health workers that had a lot of experience. But the major challenge they've been having is for people like us to be introducing this type of thing to them so that they can see the outside world through the Geneva Learning Foundation platform. But going by how things are in Northern Nigeria, for instance, now where I basically provide technical support, like the state of Zamfara and Sokoto, you will see that some of these health workers don't even have an Android phone. And that's a very big challenge, because even if they have an Android phone, they need to buy data, stuff like that, so that they can connect programs like Teach to Reach and so on and so forth. But I'm looking at it as a gradual thing. So once you show them clearly the advantages of networking, we've already seen clearly how teamwork has been helping in regards to reaching out to children that have not been immunized in insecure settlements in Northern Nigeria. Because before it's only maybe the primary healthcare development agency, but now there are a lot of partners. There are partner collaborative efforts, meetings that normally takes place at the state level, looking at who is doing what, issue of accessibility. WHO is there, UNICEF is there, My King is there, and some other local organizations at the local government and the state level. So that is a very good thing. So I'm looking at it in such a way whereby we can get key actors that work at the state level and the LGA, where they can be selling this idea to people working at the remote locations so that they can know what the Geneva Learning Foundation is all about and what they intend to gain by collaborating and by working under this platform. So that's how I'm seeing it actually. Thank you and over.
Thank you very much, Usman Tijani. So the technology challenges, yes, technology barriers, and yes, this sort of gradual approach on value of collaboration and getting key
stakeholders to buy in. Exactly.
Okay. All right. Thank you. That's very clear. Yep. All right. We have 14 minutes left. It'd be good to get some contributions, some additional contributions. You can see we are listening. There is a gap between the numbers that you reached last week. It is obvious that social media, so sharing on WhatsApp groups, sharing with your networks online is good, is necessary, but it is not sufficient because for every 226 reached by social media, only one has expressed interest. So we look to you to think through, if you are going to put effort into this, we want this effort to be productive and rewarding for you. And it sounds like, as Usman said, there is a need for more than just sharing on WhatsApp and social media. Josiah,
Hello.
Chipper,
Hello.
over to you. Yes, please do introduce yourself and tell us what are your thoughts on these issues.
Okay. Am I audible, please?
Loud and clear.
Okay, thank you. Yes, my name is Josiah, Dr. Josiah Chipa Yohana, and I am in Edo State, Nigeria. So I've been paying attention to what's being discussed thus far, and I have some observation and some contribution also. Now, Nigeria, this number that has been given, I've been thinking it could be concentrated in one particular region. Maybe 70% of the people that are included in this number that amounts to almost 30,000 may be localized to a region. So in Nigeria, as a country, we have 774 local governments. And to be fair, for us to say we have reached about 50% of the population, it means that out of this 774, about 50% of this local government cut across different regions should have had the impact of the program. Now, my suggestion, as health professional, I think, let me say, the knowledge aspect, yes, is important. And the networking is important. However, somebody must see black and white. What is he going to benefit? Should he into this program? Now, and that is where I said my contribution here is that maybe in the invite it should be clearly stated out that okay, if by joining this program, you are going to get this, and that, because there's no time for me for it. There's a limited time for you to say, okay, I send you an invite, and I'll now follow up to want to start conversing with you, trying to convince you. The people are trying to sort out their daily lives. There's no time to be spending trying to discuss and convince somebody. So if the invites are there and the information concerning the benefits are there, it will go a long way whereby if you just drop an invite, somebody that is curious will go there and check, and he or she will see it for herself. That's my little take on it. Okay, thank you.
Okay. Yes. Thank you, Josiah, for these insights. And that was one of the questions we asked you to think about last week. I'm looking, again, a couple of points. As we said, this program is designed for busy professionals. We know you're short on time. And so it's about giving and receiving support when you need it. Most tasks can be done at any time that works for you, but there are deadlines. So we asked you for any very specific recommendations for how we can improve the language that is currently on the landing page to make it clearer and simpler. Chinyere, please go ahead.
Okay. Good afternoon, everyone. Good afternoon, Rada. So I think for a start, more people are going to come in this week, if you ask me. That is one. And I want to point out something that is really crucial to us here, especially if we are looking at getting people at the grassroots level. Our human resource for health in Nigeria is not funny. We don't have enough health workers. So if we are looking at engaging our health workers, especially at the facility level, it might be difficult since they have a lot of competing activities right now. But if we will target, first of all, the colleagues at the district level and the state level, we might have at least a pool of people that can register and then be involved. Them as well can also support people at the facility and community level, because we have a very tiny human resource for health, and it's really challenging. Getting them to be involved, aside the issue of network and mobile phone, as someone has mentioned, but getting them to really dedicate their time and do extra activity outside of their already stressed and stretched schedule, it might be difficult. But if we will be able to target the colleagues at the district level and then the state level, I think we'll be able to have at least a number of people that can do this. That's my suggestion. Thank you. And over.
Thank you very much indeed, Chinyere. Blessing Ebede. Lizzie Igbin, please, we'd love to hear from you.
Thank you very much. Are you hearing me? Are you hearing me?
Yep. Loud and
clear. Okay, thank you very much, and good afternoon, good morning, good evening, everyone, from wherever you come from. The discussion is very interesting, and the last speaker just said that the pressures that other people are passing through. And I would suggest, we already have our networks. So if you can share such information on a message that we can spread around, I think that will be much easier for us, so that most people are on WhatsApp, so that it can reach further. Because if you say that we will be going to contact people individually, their schedule may be different, and the pressures of survival these days is much. So the best aspect is to share it on WhatsApp. So if you can share the link or share a message, then we send it to our various networks. That could work out for us. Thank you.
Thank you very much, Lizzie. And so Lizzie, can I ask you who you would share with, or who you have already shared with perhaps, and what the response has been? What do people say in response? Do people respond at all, or is it just one more message? We all get too many messages on WhatsApp, too many messages on email. So what have you done to make this stand out, to say this is different, this is worth your time?
Are you hearing me? Now, it has always been that we share on email, but most of the networks now work with WhatsApp. Like as a former organization that we are, and we work in communities, We have different chats, groups for people in this area, for people in this zone, for people in this trade. And I think that everybody is involved in health business. So if we share it to those networks, yes, there's really much on WhatsApp, but it depends on who you share to and who is sharing. So if they know that I'm not used to sharing junks, they will read my message. I consider it when I'm reading for people.
Thank you very much indeed, Lizzie. All right, we have 4 minutes left. I see Abdul Malik Yusuf and then Chinwe Eze. Please be brief so that we can take note of your recommendations and insights and close this meeting on time.
Okay, sir. Good afternoon, everyone. Hello, can you hear me?
Yes, loud and clear. Please go ahead.
My name is Abdul Malik Yusuf from Sokoto State, Nigeria. Mine is just, I want to state the importance of engaging religious leaders, especially where I came from. Because in my community here in Sokoto, religious leaders play a crucial role in our community because they are trusted, respected, and their support can significantly influence the acceptance and the participation of the immunization program in our community. That is my contribution. We should be thinking of engaging religious leaders most in these activities. Thank you.
Okay. Thank you, Abdul Malik. Can you clarify though? So here in this case, we're talking about reaching health workers so that they join the to invite them to join the collaborative. Do you believe that religious leaders could help convey to health
Yes, sir.
workers? Yes.
Yes,
Okay.
sir. The reason why I raised the issue of religious leaders, because I can say that 95% of people around Sokoto State are Muslims. So I know that there have been a lot of issues concerning immunization with most of the Muslims communities that do not understand the importance or how this immunization works. So, but they have a trust and respect on religious leaders, even the health workers themselves. They do respect or change their opinion because of the religious leaders. By involving the religious leaders, it will enhance our call to action, sir.
All right. Thank you, Abdul Malik. And can you help? Would you be willing to help the collaborative with this in Sokoto
Inshallah,
State?
sir. Yes, sir.
All right. All right. Thank you very much indeed. Our last comment will be from Chinwe Eze. Chinwe Eze, I hope I'm not mispronouncing your name.
Oh, go ahead. You're very much okay in line. Yeah, I'm Dr. Chinwe Eze from Imo State. I'm a public health professional and I have a personal outfit, Charlie Chin Royal. We are interested in health care. Then I want to just put in a few words here to what my last colleague just said. We are a very religious and socio-economic individuals here in Nigeria. And I think for our colleagues to be very much interested in how to engage massively, we should also be looking at the professional growth, their professional growth, how it will impact them, because I think that will help in the engagement and how it can also advance their career and make them visible in the nation. I think this is part of what could prompt a massive engagement. Of course, we'll not forget the networking opportunities and the, career goals. I think that will prompt a massive engagement with the call to action. Thank you.
Thank you very much, Chinwe Eze. And so I have to ask you, is this something that you would be willing to support and facilitate, this outreach to professional groups?
Yeah, definitely. So my own network, I know that will be a trigger and the various network I belong to.
Okay, thank you so much, Chinwe Eze. So that is our last contribution for today. Again, as you can see, we are with Charlotte, who unfortunately has connectivity problems. We are actively listening to you to make sure that this initiative fits in the right way. Our next order of business, so you'll be receiving another invitation to share with your networks. But remember, we have not launched yet. Yes. So because we will be doing this at Teach to Reach Connect 10 on Thursday. I will share again the link if you are not yet registered. This is something you do not want to miss, is this launch. And you can see there are many partners from Nigeria, so including eHealth Africa and EHA Clinics. You can see here there are many, many more partners from all over Africa, Asia, and Latin America that are participating. But Nigeria and the DRC have the two strongest and largest teams. And amongst the Anglophones, Nigeria is truly unmatched. But it, of course, depends on you and your willingness to continue to keep Nigeria where it has been in this global community of scholars, and to really make the most of this opportunity with UNICEF and NPHCDA support, that is to connect and support and to connect health workers so that they can better support each other wherever they are and whoever they are. So I apologize for going over time, but thank you for the many good contributions. We'll be sharing the summary of this meeting, the links to share and document your sharing so that we can recognize the ways in which you are spreading the word about this initiative. I'll leave it to Charlotte for a closing word, hoping that she will be able to speak.
Thank you very much, Reda, and I would like to thank everyone that was able to join today. And I join my voice with that of the rest of the team to wish a happy Eid to all those that are celebrating. And looking forward to connecting with you again next Monday at 4 p.m. Geneva time. That's 3 p.m. Abuja time. And also knowing that we'll be together on Thursday. That's the 20th of this month for Teach to Reach 10. Thanks, everyone, and bye for now.